Hello, everyone. Thank you very much for taking part of your time to spend with us this weekend. My name is Ahmed, and I will be your host for this program. And I've got with me our guest speaker, Hughes. It's a big privilege to have Los in our midst. Los has significant wealth of experience looking after women with chronic pelvic pain. Thank you very much, Los, for accepting to spend part of your weekend with us.
That's okay.
Yeah. Before I proceed, I will like to quickly talk about our NGO, the Africa Pelvic Pain Advocacy Network. So the Africa Pelvic Pain Advocacy Network was actually formed not too long ago by people who are worried about the burden of pelvic pain, especially on the continent of Africa. And the aim of the NGO is to advocate for people suffering from this debilitating condition. The emphasis will be on endometriosis, which is a leading cause of pelvic pain amongst women. And we are interested in everything pelvic pain, including in men, boys, and women as well, as the name of the NGO suggests. Today, we will be talking about endometriosis pain coping strategy. Luz will take us through what endometriosis is all about, some of the signs and symptoms, treatment options before we delve into the main question and answer session. Without further ado, I will invite Luz to give us her brief talk, and then the question and answer sessions will follow. Luz, over to you. Thank you.
Hello, everyone. I'm Hughes, and I work in St. Peter's Hospital in the UK, and we are one of the probably 70 centers for endometriosis now in the UK, and we have treated severe disease about 83 cases in 2023, and before that, when there's only a few centers, we were in the 100 region of severe cases. But saying that, we probably could operate more, but in the UK, unfortunately, we have very long waiting lists, so sometimes women have to wait for their surgery. But anyway, the specific condition that I look after is women with endometriosis, and I want to share my, how do I share my presentation, Ahmed? Can you help?
In terms of sharing the presentation, what you can do is, instead just, since it's going to be a very brief one, and just go through it and discuss it straight on.
Okay, yeah. Sure. Yeah. So basically, endometriosis is tissues similar to the lining of the womb, and they migrate to different areas in the pelvis. So they could be on the ovaries forming cysts, or they can be on the fallopian tubes. They can be on the ligaments, which can cause pain in the lower back. They can be on the bowel, causing bowel symptoms. They can be on the bladder. So anywhere, basically. And what happens is during certain times of the month, when the lining of your womb responds to the hormones produced by your ovaries during ovulation, and at the same time, at the end of your cycle, when you start bleeding, these tissues copy the lining of the womb. So they flare up and then they bleed, but they don't have any exit point, and they stay where they are. And where blood is, where they shouldn't be, they act as glue between structures. So things get glued together, and that in effect, apart from the flare up, can cause pain. So adhesions and the flare up causes pain. And in some women, they come to us presenting with cyclical pain, depending on where their endometriosis is. But the longer this progresses, the disease progresses, sometimes they won't even have a certain gap of pain because the flare up just carries on continuing. And at this point, we don't know what the cause of the disease, the endometriosis is. We've had a few theories, but so far we haven't figured out a concrete sort of reason or cause for why this happens. There's also so basically the symptoms are, one is pain, pelvic pain. So usually we get pain during our periods. Sometimes they can be more uncomfortable, but in women with endometriosis, they can be unbearable. So teenagers, sometimes they can't go to school, or they can't perform in PE because the pain is so painful. The pain is so severe. Women who work, sometimes they take time off because they just can't manage. And these are women who are used to taking painkillers almost every day just to be able to function. So imagine during their period or during their ovulation, the pain can be so severe that their normal painkillers don't work anymore. Other symptoms would be, sometimes they would get diarrhea or constipation if they have disease on the bowel, and sometimes bowel movement can be painful itself. And other symptom would be pain during sex. And some women don't even realize this is part of the symptom because they didn't think it was supposed to be, it's not something that would happen. Sometimes we have found some endometriosis either in the cervix or in the vagina, which can also cause pain. Other women get recurrent cystitis or urinary tract infection when they have sometimes blood in their urine or blood in their stools, depending on the severity or the extent of the disease as well. What else? Have I missed any other symptom?
Well, is it sometimes some of these women will come with IBS type symptoms?
Yeah,
Is that true?
IBS. Yeah. So sometimes it could be diarrhea. Sometimes it could be
Okay.
constipation.
Yeah.
And some women also find getting pregnant difficult because if things are
Okay.
plastered together,
Okay.
sometimes it's not easy to get pregnant. And the common side effect is fatigue because of the cycle of pain. There's no respite from pain, and women are at the same time still doing physical jobs or working around the house while they're in pain. In the end, they just run out of energy while they're still coping with pain and doing their physical work. So a lot of women in my clinic say they're so tired and they don't know why. They're in their 30s or 40s and they're not meant to be this tired. But if you understand that we use energy for anything, so pain itself uses so much energy that we get really, a lot of women get really tired, and they can't last through the day. And even if they sleep, they're in pain, so they're not sleeping properly. Okay. And lately, we've been seeing a lot of other cases where there's chest pain as well, and we find disease in the diaphragm, and then some on pins and needles and sciatic type nerve pain, where we find disease on the nerves. But that's quite rare, although saying that, we've been seeing a lot of cases lately.
Yeah.
Can you?
So yes. So sorry for interjecting. And
That's
now
okay. Just a plug, please.
in
Sorry.
your clinic, often, I mean, in terms of racial distribution of people suffering from endometriosis, do you tend to see it in one particular group, or it cuts across a race? And that's one. And then the other question is, do we really see it even amongst adolescents, for instance, and maybe older
Yeah,
women?
yeah. Yeah, so before we thought, okay, it's more of a working age type disease, but now we're seeing a lot on younger women. I don't know if it's because the GPs have become quite good at picking up the disease and referring them straight away. But we're seeing a lot of 16, 17-year-old, although we wouldn't offer surgery straight away. And then if you think about it, because it's hormone driven, by the time they go onto menopause, the pain should start clearing off. But then in theory, when their ovaries no longer produce hormones, some of the women with on menopause can still get sort of a cyclical type pain even when they're menopausal, but that's because some of the lesions themselves, they carry in estrogen, so those itself flare up on their own even without the ovulation trigger.
Okay, that's good to know. How about the racial distribution? Do you see people from different ethnic backgrounds suffering from this condition?
I see a mixture. They could be among the white people, the colored people. They could be the Mediterranean group, and I don't see any particular pattern on who gets
It can affect every racial group.
every racial. No.
Oh, so I think
Sorry.
that's a very important point for us to highlight.
That
So,
one over there by the sofa. Sorry, Doug.
no problem.
Okay.
I think you're making a very important point that when we talk about pain due to endometriosis, it knows no racial group. It cuts across the groups.
Yeah.
So that's a valid point. And I was also, there was this question that came and discussing, why is it that it's very difficult to diagnose and it takes a long time for people suffering from endometriosis to eventually get a diagnosis, especially due to the pain? I know there has been mention of doctors, for instance, or medical people dismissing pain, especially due to period, and saying to these women, oh, it's all in your head. It's going to go with time. You don't have to worry about it. Maybe I think that potentially could be one of the reasons. But from your experience, are there other reasons why you think we are struggling in making a diagnosis?
I think one of the reasons is because we probably don't have a very sensitive imaging. So far, we've been using transvaginal ultrasound or ultrasound. MRIs are very good at picking up, but sometimes they can only pick up severe disease. So we mostly go by the patient's symptoms and a lot of, which is pain, and sometimes infertility, because sometimes some
not
women
being able to get pregnant.
Yeah, exactly. And sometimes those women with issues with fertility, though they might not have any pain or symptoms, they just couldn't get pregnant, and then in which case we get referred those patients when they've done all their fertility investigation, and then they find a lot of disease there. And so I think sometimes as well, when women get so used to the pain, it becomes normal for them until it becomes excruciating, and then they end up in A&E, and then it all starts. So I think it's one of the things that it's not typically discussed between women. It's like, even in the family, nobody sometimes opens up. Oh, my period's really painful. I've got 2 girls. They never talk to me about their period.
Oh, and you see, that's why we're doing this, just to highlight it.
Exactly.
A question just came through quickly, Los. What causes endometriosis?
We don't know. So there has been theories about genetics, but I've seen patients who